afternoon, everybody. First, I want to congratulate us on our march and rally today. And we need to not be disappointed by the numbers. It just means that we've planted a seed. We need to organize and we need to spread the word and we need to build for a march next year that is 10, 100 times bigger. And we can do it. We all know that in the United States, we don't have a health care system. We have a health harm system whose purpose is to enable the CEOs and shareholders of private corporations to exploit us to get horrendously and outrageously rich, even though it's killing us. In this country, in this world, 1% of people in this world own 50% of the wealth in the whole world. And most of those people are right here in the United States. They're our oligarchy. This is why, despite having the most expensive healthcare system in the world, Americans are the sickest and have the worst health statistics of the 30 richest nations in the world. We have the worst infant mortality. We have the worst maternal mortality. We have the shortest lifespan, and I could go on and on. This is why we pay 2 to 7 times more for drugs, for medications, including insulin, than anybody else in the world. Why we have the longest and deadliest of wait times. 68,000 people die yearly and 1 million people died during COVID. So next time somebody tells you, oh, well, in those countries that have Medicare for all, that have single payer health care, they have long wait times. Well, our wait times are so long, people die. And that's what you need to tell them. Why the majority of Americans are being crushed under horrendous debt, of which medical debt is a large part, and at least 40% of Americans have medical debt of $5,000 or more. Why our jobs and why our states can prevent your right to control your body and your well-being by offering policies that don't include full reproductive health and don't include things like full mental health services. Why Americans have less free choice to see the doctors they want. Nobody wants to choose an insurance company. We want to see the doctors and healthcare providers we want. Yet we have less free choice than anybody else in the developed world to see whom we want because the private insurance companies decide who we see. Why Americans are the only people in the richest 30 countries that have to do GoFundMes to pay for needed care, and so on. Why don't we have single payer health care? In other words, improved Medicare for all. And how do we get it? We don't have single payer health care basically for 2 reasons. The first is that the private insurance companies, private hospital chains, and big pharma have banded together to form lobbying groups, the biggest of which is the Partnership for Americans' Healthcare Future, to pay off the president and your Congress people to work against your interests and for their greed. There have been studies that show that when our oligarchs, when what they want is different from what we need, 85% of the time our politicians go with what those oligarchs want, not with what are the needs of the people. The second reason is that our politicians of both parties have bought the oligarchy's line that their job is to enable the super wealthy to find more and more ways to steal from the public coffers to enrich themselves at the public expense. These political leaders and public officials like Liz Fowler of CMS and the politicians of both parties, and yes, Biden himself, have bought the line that despite all the evidence of increasing corruption and wealth inequality, that enabling these greedy fat cats to steal our public wealth to enrich themselves will somehow improve society. That's what's known as neoliberalism. Well, in healthcare, we can see where that neoliberal philosophy has gotten us, how it has harmed us and is killing us. And And the prime example is the 1 million COVID deaths. This is why when 70% of the public says it wants comprehensive public health care like Medicare for all, the government is proceeding with direct contracting and ACO REACH for Medicare and the dismantling of the VA. This is what President Biden, who received more money from these lobbyists than any other presidential candidate, meant when he said nothing will fundamentally change. The corruption of our politicians by these lobbyists and others like it is why your health care costs are going up, while your access to care and freedom of choice to pick the health care providers you want is going down. This is why our government is now assisting these thugs in destroying Medicare and deprivatizing and dismantling the VA instead of improving this. According to the Federal Inspector General's Office, the Medicare Advantage companies, which are just private insurance companies, have defrauded the Medicare Trust Fund of at least $10 billion yearly, rapidly drawing down the fund to depletion. The Trump administration came up with an even better way to exhaust the fund through this program called direct contracting. When Biden came into office, did he stop that program? No. He just changed the name to ACO REACH like we were dum-dums and made a few cosmetic causes. Why? Because he's marching to the tune of the health-harming insurance and private equity industries to help them get rich at our expense, even if it kills us. This is why, despite massive evidence showing Americans are not overusing healthcare, they actually use it less than people in other developed countries. This is why the system is increasingly restricting our health care access and leading to greater, not less, racial inequality by increasing premiums, deductibles, and copays. This is why, despite massive evidence showing that this concept of value-based care is a failure that in terms of containing healthcare costs and providing quality and equitable care, HHS and CMS are pushing forward privatizing programs like direct contracting and ACO REACH, programs whose real purpose is to help greedy corporations fill their pocketbooks at your expense to the detriment of the public's health and even to kill you. This is the real reason why Jeff Bezos, I'm sorry, I called him Bozo, but Jeff Bezos, Amazon, has now come in for the kill. He's come in for the kill. He wants to get that money. He's not interested in your health care. The problem in our country isn't big versus little government. Government is the infrastructure by which a society gets its needs met. The problem is that the American oligarchs have stolen our government. They've stolen our infrastructure. They've stolen our way of getting our needs met. We need to reclaim our government and take it back from them so that we can get our needs for health care and other things met so we can have Medicare for all. To do this, we need to educate our families, our friends, our co-workers, our fellow union members about how our health harm system is not working for us, even though it's the most expensive in the world and is even killing us. Then we need to mobilize as many people as possible to say to these politicians, we will not vote for you unless you pledge to support a single-payer healthcare system, such as Bill HR 1976, and you pledge not to take any more funds from these health-harming lobbyists. Furthermore, we should join in with other groups pressing for our needs, such as groups pressing to get rid of student loan debt, to raise the minimum wage, to reinvest in our public schools, to codify a woman's right to choose, to equitably address our climate change, to expand union rights, and to gain us paid parental leave and affordable child care. By the way, we're one of only 4 countries in the world that doesn't have paid parental leave. We need to be just as forceful and loud as the right and requiring these candidates to pledge not to take 1 penny of corporate monies and to meet our demands for Medicare for all. Thank you. Woo!